This Monday, we keep hearing about this COVID-19 model that Governor Tim Walz is using to help guide his stay-at-home decisions.
It is a joint effort between the Minnesota Department of Health and the University of Minnesota. So what does the model say, and why is it so different than some of the other models that we've been seeing from around the country? This is pretty complicated stuff, Heather.
It's very complicated, and these researchers are PhDs who are doing very complicated math equations to try and figure this out. This is often done in viruses where you have people trying to make these projections out on when the peak might happen, how many people might be affected, how many people in fact might die. But as you always heard, and you hear Dr. Fauci saying this quite a bit, that these models are really only as good as the assumptions we put into them. So you always have to understand that when you're talking about models.
And I think it is important to say it's valid to question these assumptions and to question these models, because the truth is these models are guiding decisions that impact people's lives, but also their livelihoods. So,
absolutely.
That's why these things have maybe come under the microscope a bit over the last several days.
They sure have. And even Governor Walz himself says, I am questioning these models. I am constantly questioning these assumptions, too, because if you look at them, these models right now, the models that we have here in Minnesota, the ones with the Minnesota specific information, they have our peak cases and our peak ICU bed usage peaking in mid-July. They do have a range of sort of late June to mid-August, but they also have, they put a number on deaths, and the state will ask you, don't look at this number so closely. The number right now, the midpoint is 22,000 here in Minnesota deaths, but it could range anywhere from 9,000 to 36,000. A lot of people have focused in on that number, but what the governor says is, let's not focus in on that number. We gave that number to you in the effort to be transparent, but what we want to focus in on is the trends. And as we do more social distancing, the trends are showing us that we would get fewer deaths and fewer people infected.
Sure, but when you look at the University of Washington model that says 442 deaths, I think it's understandable why people would say, like, why should we trust anything with this Minnesota model when you're looking at 442 versus 22,000?
Absolutely. And there's a lot of people that are just doing, I heard this several times on Friday, this sort of back of the napkin math and saying, how could this could even happen?
But you found there are some assumptions in this that, at least if it doesn't totally explain it, it makes a little more sense.
For sure. And right now, that Minnesota model, I mean, you're talking about the full extent of what this could be until we get a vaccine. We're talking 12 to 18 months. The Washington model only goes out through the summer, and what the Washington model does, it makes the assumption that the social distancing that we're doing right now will continue throughout that time. The Minnesota model says, look, we're not going to be social distancing for a year from now. So what's going to happen over time, we're not entirely sure, but we think there are going to be several peaks of this over the next year or so, and that's giving us some information about where those peaks might happen, how often they might happen, how many people might be affected, in the timeline that we have.
Yeah.
It's complicated, and they're constantly changing this model. We should expect to be updated as they learn more information about how social distancing is working.
Yeah, I mean, it's not a direct parallel, but when you look at like our weather models and they predict snowfall, you know, sometimes you'll see a model that'll show half an inch and another one will show 13. And you're like, how is it possible?
And the hard part about this is we just don't have a ton of data. And it's all new, and we don't have a lot of testing, and you'll see. So.
Well, let's talk.